Parents are anxiously awaiting the rollout of COVID vaccines for kids ages 5 to 11. But as the colder months approach and we head indoors, should families consider creating COVID bubbles again for an added layer of safety? Joining me to talk more about this, Dr. Karl Minges, Interim Dean of the School of Health Sciences at the University of New Haven. Dr. Minges, thank you so much for being with us.
Happy to be here. Thank you.
So I think there are a number of things in play here. The holidays are not only coming up, it is getting colder, and I think there's a level of COVID fatigue really amongst all of us. So do you still feel that given the current situation and that children under the age of 12 don't have the opportunity to be vaccinated, should they be avoiding indoor gatherings with their families?
So there's a couple of things to consider here. Of course, the expectation would be that those between 5 and 12 will be able to be vaccinated by the holiday season, in which the advice I'm giving may not be the same. Currently, with the rates sort of being around less than 2%, we're pretty confident that the pandemic is sort of under control in many parts of this state. However, as the colder months appear and there's less opportunity for ventilation and gathering in large spaces that are well ventilated, we are going to have to rethink and consider the rates and the likelihood and need perhaps for the same bubbles to form as they did in the year prior, especially for those who are unvaccinated or who have family members who are immunosuppressed and at risk.
Experts and doctors keep reiterating the fact of stay outside, stay outside. It's better to be outside. But obviously with it getting colder, that becomes less of an option, like you said. Are there any other precautions besides staying outside that parents can take to make sure their kids stay safe?
Yeah, so of course the traditional mask wearing and washing of hands, and I think bring up this possibility of forming a bubble. You could imagine a situation where parents have, like myself, other friends of other parents who have the same children in the same class, and that's who you form your bubble with. So that way the students are being exposed to the same people of those in their indoor classroom, as well as in the outside environment if you're seeking to socialize in that way. Otherwise, it is all about engaging in outdoor activities. It's projected to be sort of a tougher winter, perhaps, from everything I've been reading. So really being mindful of the spaces that you're going in and to be sure that your mask's up whenever that's possible. And also to go to places typically when there's less occupancy. So for example, go to the library with your child at 9 a.m. when it opens up. Don't wait for the peak hour of 2 p.m., for example, during the winter break.
Some very, very good advice. Dr. Karl Minges, thank you so much, as always, for being with us and sharing all of your thoughts on this. We appreciate it.
My pleasure.
I'm Wendy Gillette.